a lot of times OCD, anxiety, ADHD, they all kind of intermix and interplay. And so there might be a little bit of, nobody has, most people don't come in with one diagnosis. People that experience depression will also experience anxiety and other things as well. And so we do have some patients with ADHD, but also anxiety and depression, and it's really helping kind of all of their symptoms. So yeah, it's definitely working for ADHD as well. So if you have a seizure disorder like epilepsy, then we would not recommend ketamine treatment. Right, so the pain protocol is a little different. So we'll do 5 infusions instead of 6. And the infusions, we give a higher dose of ketamine. So the infusions go over a longer period of time. So they're about 2 hours instead of 40 minutes. We are seeing a lot of patients that have chronic pain, stuff like joint pains, people that have had spine surgeries, hip replacement, knee replacement. We treat a lot of patients that have fibromyalgia and CRPS also with really great success. One of the things that's very interesting is actually using ketamine to treat patients with neuropathies. And so there's patients that have trigeminal neuralgia, which can cause very severe sharp pain kind of in the face region. We had a patient that had a form of trigeminal neuralgia that affected her mouth. And so her mouth was always in a state of pain and burning. If you can imagine how terrible that would be. She had great success with ketamine and now doesn't have to suffer with that anymore. So it's being used a lot for treating the nervous system in other types of disorders as well. So it's a chemical compound, just like if you think about, any other types of medicines, it's just a chemical. It can all be kind of broken down into one chemical molecule that will actually go into the system, and each molecule can target different receptors in the body. And so it's like a lock and key if you think about that. So you have the ketamine molecule, which is the lock or the key, and then you have the receptor, which is the lock, and the key will bind the certain lock and open it up, and then you'll get kind of a downstream pathway where you're gonna have all of these proteins being generated in the cells. But it's a chemical, just like anything else. I mean, I was talking to somebody the other day, like drinking coffee. Caffeine is a molecule, and it works in the body on certain receptors to do certain things. So that's it's made in a laboratory, and we get it from the pharmaceutical company, and that's. So dopamine is a neurotransmitter, almost like a hormone. But again, if you break everything down into a cellular level, everything is just a bunch of different atoms that are kind of created together into a molecule. And so these are all molecules. Dopamine is a molecule. They're all molecules. They just kind of work differently in the body. Yeah, so the dosing is all based on weight. Height does not play a factor. We're not using BMI or anything like that. We're just using weight. And it's interesting, some medicines you'll have to do a weight adjustment if somebody is either overweight or underweight. For ketamine, it doesn't work like that. We're treating people with a standard weight-based dose, and it always works the same way for those people. Well, so I will say when we start at a standard weight-based dose. As we go through the 6 infusions, we end up titrating people up as tolerated, because the more medicine we can get in someone's system, the better, but we don't want to cross into that sedation and an ill effect type of realm. So we do slowly, as patients tolerate and we get to see how their reactions are to the actual medicine, can titrate them up. But when we start at that low dose, it's so safe and everyone's having just a really good experience, and then we can kind of go up from there if we feel that's appropriate. Well, so in our clinic, so one of the most common things is nausea. And so in our clinic, we pre-treat everybody with Zofran for nausea, because nausea is the kind of thing it's easier to get ahead of than to try to treat once you're already nauseous. We did have one patient in his infusion become nauseous and required another dose of the Zofran. But beyond that, that's the only thing that we've seen actually in the infusion where someone was having a hard time physically.